Hey friends, for those of you that are new here, I'm Dr. Meggs, and this is Everyday Vet, where we bridge the communication gap between medical professionals and pet owners. Today I'm going to talk about a surgery that I did on Hades here. I saw that he had a mass near his butt, and looking at the mass, you can't tell what it is. So I took him into the clinic, and we took a sample so we could look under the microscope. I got the sample with a needle, so it's a limited sample size, but it's at least better than what we can get from looking at it with our eyes. I looked under the microscope and I saw that it appeared to be a non-cancerous cyst. However, his mass kept growing, and I was worried about the location of it, that it would start to cause some structural issues with him going to the bathroom, so I decided to take him to surgery. So we did the surgery, we removed the mass, and then I sent it out to the pathologist so that way I could have a full report on it and just make sure that it was in fact benign, as in not cancerous. So today, I'm going to show you that surgery. So it is surgery, so there will be a little bit of blood involved. There's going to be needles too. So if you get a little bit queasy with that or don't want to see it, just skip ahead to the biopsy results section. The timestamps are linked in the description below. So skip ahead to that. That way you can see the results of the surgery and what the report said. But if you do want to see the surgery, that's what I'm going to show next.
Good job, Hades. Good job.
You didn't even flinch.
Good job.
Oh, right now, Dana's just placed the IV catheter, and we're going to tape it in so that way it doesn't fall out. It's important that we have access to his veins so we can give him medications and fluids during a surgery. So right now I'm going to give Hades a little midazolam, which is a medication to kind of help with relaxation. And now we're giving him Rimadyl, which is an injectable non-steroidal anti-inflammatory to help with any pain or inflammation from the surgical procedure. We have to lubricate his eyes so that way he doesn't have irritation on his corneas. Since he's asleep, he's not able to blink on his own, so we have to make sure to protect his eyes. I know, that bump never went away. Hades has a little mass in his mouth that's benign, but still there. And now we're putting a tube into his trachea so we can provide oxygen down into his lungs while he's asleep.
Yeah.
So right now we're kind of doing the initial prep on the mass. We have to make sure to remove the hair in the area and get it as clean as possible so that way we don't get any contamination in the surgical site. It's a fairly not clean area, of course, so we already expressed his anal glands. That way they don't kind of leak out onto the surgery site. And right now just kind of shaving up the hair. We'll do a cleaning of him out here, and then he'll get another cleaning once he's actually been moved over to the surgery table. But basically we just have to do everything we can to get rid of any surface contamination as well as any bacteria that are just naturally in that area. Because once they cut through the skin, we're exposing, the underlying tissues, and I don't want him to get an infection after the surgery. The growth's not really in an ideal location cleanliness-wise, so we have to be a little bit more careful with it. It's also a tricky location because if it gets too big, there's some pretty important structures right there, and we have to make sure that he doesn't become incontinent to where he can't control his bowels. So just have to get it clean and get the growth removed. All right, so right now we're getting ready to remove Hades' mass that he has near his butt. I want to get it off now while it's still small so I have plenty of tissue to work with and so it doesn't cause any problems. Right now I'm opening my surgery packs. keeping everything sterile. Make sure not to touch anything extra. We have a bowl here that we're going to fill up with some saline because I use a surgical laser, so we use this with it a lot. And then now I'm going to use a sterile drape to kind of cover the area to prevent any contamination from non-sterile stuff outside. Organizing my table a little bit. Alright, now I'm going to cut a hole in the drape so I can access my surgery site. I'll feel it through the drape. Okay, right here. I'm going to use some clamps to hold my drape in place because I don't want the drape that's touching the non-sterile field to enter my surgical field. Otherwise, I would defeat the purpose. Okay, now that I got that draped in, I'm going to put my laser attachment on. So now I'm going to make an incision around the growth, and I have to make sure to try to make it pointed on the end. Otherwise, trying to close a circle is not going to be very ideal. So I tend to make it like elliptical as much as possible. It's bleeding a little bit from where I poked it earlier. I use a surgical laser with these because it kind of cauterizes as it cuts, which definitely reduces on bleeding, and I just find that I get a cleaner cut with it too. So I definitely have a better visibility when I'm using the laser, and a cleaner cut as well. So my initial cuts are just through the surface layer of the skin so I can make sure that I'm getting a good planning on it, and now I'm going to kind of clean up some of that burnt tissue from the laser and just see what we're working with. I definitely need to go deeper on this side. Alright, and not get very deep underneath it. I'm going to feel more there. My favorite surgical site to work with. Nice tight quarters. Surgical laser really does cut down on the bleeding though, that's for sure. Good depth on this end. I'm going to use the laser again, get through the skin layer a little bit. So when I do this, I kind of work around and try to scoop up underneath the growth, so I'm not removing extra tissue, but so I'm making sure that I actually get the whole thing. I think that this one is benign just based on the fluid-filled sense of it, so I'm not getting huge margins on it, but I am trying to make sure that I actually get the whole thing out. The mass out and set it aside so we could keep it sterile.
Reels here for Chanel. Do you want her in the room first, or do you want her checked out? Room first.
All right, can I have some 3/0 suture, please?
Do you want me to hold it for the suture part?
Yeah.
Okay.
Can you come down with it and pull more this way on the skin? Yeah. Stripe's a disaster. I might have you hold up more now instead. Yeah. Excellent.
Helping?
Yeah, it's helping. Not an ideal location up here. So when I'm making this knot, I want the knot to stay under the skin. So I'm going to make sure that the suture lines that I'm using end up there. So this first bite that I'm going to take, starting from a superficial layer and I'm ending with a deep layer.
Did you give her an e-collar? Okay, good. Good.
And then with this one, I'm going to start deep and end superficial so I can save this loop to use to tie. And then I'm going to go this superficial to deep, so this comes out deep, and I can use that to tie. I'm going to do the skin layer, so I have to start super. Did you just move?
Me?
He moved his butt a little bit.
Oh,
Was it you or him?
I don't think I did.
Okay. He's not right now. I must have just gotten a nerve.
Oh, maybe.
Let's see about when it's easy. Suturing in the dermal layer right now, so that way there isn't any stitch material present on the outside. I don't want to put skin sutures in and have him pooping on them, because it'll just drag bacteria deeper into the incision. So I'm making sure to keep all of the suture material buried, so we won't have to worry about that. going to do the same type of buried knot on this side that I did a deeper layer. I'm going to use some surgical glue too.
Okay.
Great, Betty. Thank you.
Good then.
All done. This is the mass we removed from Hades. I suspect it's a cyst because it had some fluid in it, but I'm going to send it out for pathology evaluation anyway. So cut it up into tiny little slices and look under the microscope, and that'll just determine, what cell line made it. Is it cancerous? Is it benign? And, did we get all of the affected tissues, or, do we have to worry about any kind of recurrence? There's no way to know for sure if it's benign unless we send it out. So that's what I'm going to do with this one. So we removed the mass, we sent it out to the pathologist, they processed the mass, they looked at it under the microscope, and then they sent us back this report. So let's break down this report a little bit. So first we can see that a microscopic description section. So that's a lot of medical jargon that's basically just describing where the affected cells were that they saw, what they looked like, where they extended in the different layers of the skin. But the real important thing here is going to be when we go down to that microscopic findings section. That's really their analysis and their summary of that preceding microscopic description. So for Hades, they said that it was a hepatoid perianal gland adenoma with ulceration and chronic granulomatous inflammation. That's a little bit of a mouthful. So hepatoid gland, perianal, so that's going to be those glands within the skin layer that's kind of around the butt region. It's just saying that the mass that we sent out was a mass of that tissue. Adenoma, so it ends in oma, which means it's benign, so it was non-cancerous. And if his had been a cancerous type mass, it would have been called a hepatoid perianal gland adenocarcinoma. So carcinoma indicates that it's cancerous, whereas just the adenoma indicates that it's benign. So good news there. The pathology report did agree with our previous conclusion that it was not cancerous, so I was really pleased to see that. With ulceration, so that just means that the surface of the mass, there was defects in that skin layer. It did have some bleeding, so if you saw during that surgery when I was dabbing at it quite a few times, I mentioned that the mass was oozing. It's just that there were some breaks in the skin layer where that gland tissue was kind of secreting its goo, essentially. So the ulceration just refers to the surface layer of that skin. And then chronic granulomatous inflammation means that it's been having this long-standing inflammation of the local tissues. So then we go down to the next section, which is, it's important for this mass, but it's more important for those ones that come back cancerous. Specifically, we need to make sure that we got rid of all of the affected tissue. So this one says that the mass is approximately separated from the narrowest deep margin by 1.7 millimeters and from the narrowest lateral margin by 2.4 millimeters. So that means that if you look at the mass, so if this is my skin layer, here's the mass kind of sitting in it. Below the mass, I got 1.7 millimeters of healthy tissue that did not have any affected cells. At the narrowest point, there were some sections that had more healthy tissue, but at the narrowest margin was 1.7 millimeters of good, normal, healthy tissue. Lateral being out to the sides. So the side aspects of the mass, at the narrowest portion, I had 2.4 millimeters of good, healthy tissue. So that's good. That means that I got everything. The affected tissue did not extend beyond the mass that was removed. And it's definitely important in any cases that we have like a cancerous type tumor, because you need to make sure that you remove all of the affected tissue, or you could have local recurrence, you could have the mass spread elsewhere in the body. So that's a really important thing to look at on this report. And then if we go down to the next section, the comment section, the pathologist did specify this mass is completely excised. So again, that just means that we removed all of the affected tissue. It is a benign tumor, so non-cancerous, of the hepatoid glands, which are the modified sebaceous glands. So sebaceous glands are a type of gland that sits at the base of the hair follicle. So this is a specific type of gland, the hepatoid glands, that's in the area of the mass that were removed. So it's just basically an overgrowth of that gland tissue resulting in mass formation. There's a little bit more medical jargon in this section, but basically what they're saying is there may be associated cellulitis, so inflammation of the cells in that region, hemorrhage, so some bleeding, and ulceration, again, like just a breakage of that skin barrier due to leakage of glandular secretions into the adjacent soft tissues. So the glands naturally produce this kind of like lubricating type fluid, and if that leaks out into the tissues, it can cause some local reactivity. So nothing like overly concerning, but basically what this is describing is just things that you can see in general with the type of mass that we removed from Hades. So key things, the report told us that the mass is in fact benign, as in not cancerous. We did get good clean margins, meaning that we removed the entirety of the mass. And then it goes over some things to see, like, do we have to worry about it recurring? Is this something that could spread elsewhere in the body? This section does come a little bit more into play again with like those cancerous type tumors, because it will tell you the prevalence of it spreading elsewhere, even where it might spread. So it gives you a lot of good information on just where we might be needing to go in the future. But Hades mass was a little bit simpler because it was benign, non-cancerous. So good news overall. And as you can see, when we send out that mass, we actually get a really good, thorough report.
So as you can see, Hades is doing quite well. It's been about 6 months now since his surgery, and he's completely back to normal. It really didn't take him very long to recover at all. He was back to his normal self within a week. He never really had any complications of the surgery. The incision never looked infected. It never opened up or oozed or anything. So I was really quite pleased with his overall healing process. And he hasn't had any kind of mass regrowth since. So I can actually show you where his surgery site was. It's completely healed now. And again, he hasn't had any reoccurrence of that mass. So if we lift up his tail here, you can see there's that little hairless section. That's what's remaining of his scar from his surgery. So the hair probably won't ever fully grow back in that area, but that shouldn't cause him any issues. And he has not had any problems really from it. It's really healed up quite nicely.